Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another episode of the Best Docs Network featuring Forest Park Medical Center, Dallas, Frisco, the #1 medical facility in the entire Dallas-Frisco area.
That's right, and we're going to kick off our show with our first Best Doctor who operates right here out of Forest Park Medical Center. It's orthopedic spine surgeon, Dr. Mark Valente.
I was injured at work, and I had hit my tailbone, so I thought that I had just tweaked my tailbone. Nothing could be done for it, so I just continued working. Well, as time rocked on, it continued to get worse and worse until I had to have the ambulance come get me to take me to the hospital.
Elizabeth's case was very unique. She had a large herniated disc and it was severely compressing her spinal nerves. I got a phone call from the emergency room. It was on a Sunday night, and they told me her symptoms. And I immediately knew that this was much more than just your average herniated disc.
He called in his team and he operated on me that night. He was just, it's like, boom. I was so impressed with that.
The procedure that's performed is we make through a small incision. Her situation was much more severe. It was a little larger incision because of that, but still minimally invasive, where we're able to just spread muscle out of the way as opposed to tearing the muscle and tearing tendons and ligaments. When you tear muscle and you strip ligaments, muscle does not heal back together. Muscle scars back together. So your fibers will never sort of regenerate and reconnect. So it's important to preserve muscle function, and that's why we've developed these minimally invasive techniques where we place a tube through the muscle fibers, just spreading the muscle fibers. I'm able to operate through the tube with specialized instruments and microscopes and able to free up the nerves so that they're no longer being pinched or compressed, and take out the disc herniations that are hitting the nerves so that they're not being impinged anymore and the pain and the weakness goes away.
And I woke up the next morning and the pain was gone. I mean, and that was a big thing right there because I couldn't even sit up. It's the little things that you don't even think about, just being able to sit in a chair, just being able to ride in the car, that, you know, now I can do that I couldn't do then.
Forest Park wants to be a center of excellence for women's health, and so I thought Forest Park would be an excellent entity to team up with. As of last week, we were the first hospital, and I was the first physician to do the Acessa procedure here in the state of Texas. The Acessa procedure is a great way to treat uterine fibroids, especially those fibroids that are inside the wall of the uterus. For the longest time, we really haven't had many ways of treating those uterine fibroids. The problem is you can't see those uterine fibroids under a telescope or a laparoscope. With the Acessa procedure, we're able to use a new innovative laparoscopic sonogram device that allows me to actually see the uterine fibroids on a sonogram machine at the same time I'm looking at the uterus through a laparoscopy.
Prior to the surgery, I was feeling tired. Fibroids make you have excessive bleeding. I had heavy periods anyway, but the fibroids made my bleeding heavy. And so by me having heavy bleeding, it made me anemic. And so that made me tired. I mean, I could go to work, come home, and I just go to sleep because I was too tired to do anything else. I couldn't continue to live like this. I was doing different things to try to relieve the pressure, but it was a temporary fix.
When she went to see her gynecologist told her that her only option was to do a hysterectomy. She didn't want to do a hysterectomy. When I presented the Acessa procedure to her, she was just very, very excited that she could return back to work in a few days to a week, that she didn't have to undergo all the risk of a hysterectomy, she could keep her uterus, and that there might be some other way of treating her symptoms that she presented to me with.
Prior to the surgery, I had been on my menstrual for 2 weeks, and I was weak and I was tired. But since then, I feel like I have more energy. I feel more confident. You don't have to worry about my period gonna start without me knowing. And so it really changed my life. I'm very hopeful.
One of the most exciting things for me about the Acessa procedure is I think that it's going to replace hysterectomies for the treatments of these uterine fibroids that are hard to get in any other type of surgery. I think it's going to become the standard of care within the next few years as more and more physicians learn how to use it.
Did you know that Forest Park Medical Center Pharmacy is equipped with a fax carousel? This system helps better manage inventory by automatically tracking drug inventories in near real time. This system also supports efficient packaging and labeling of medications within the pharmacy.
One of the main reasons why I came to see Dr. Angobaldo was because I was not happy with the symmetry of my breast. I do body figure competitions, and when I lean out, you could really see the symmetry of my breast, where my left one was a lot lower than my right one. The implant was very noticeable, and also wearing a bikini two-top, you can see that the left breast was a lot lower than the right one. And so I always either had to pad it or tape it or do something so that it wouldn't be as noticeable. And it was just very bothersome.
So the initial consultation with Claudette, she was unhappy with the asymmetry of her breast. She had previous breast implant surgery by a different surgeon several years ago, and she thought that one implant was lower than the other, which caused less fullness in one breast than the other. She was very self-conscious of that. She competes in fitness competitions, and she wanted also to switch out from a saline to a silicone implant.
As far as the procedure, pre and post, the pre was very comforting. The staff was wonderful. I never felt nervous. Everything from Dr. A to the nurses and anesthesia was great. Post-surgical, probably 2 to 3 days is what I took, and then I was able to get back into my everyday life routine.
Claudette is doing fantastic. She is 5 weeks off from surgery. She's had no complications. She's perfectly symmetrical. She looks fantastic, and I'm gonna free her up to start competing again and working out within the next week or so.
Now that I've had the surgery and I'm symmetrical, it's definitely a boost of confidence. I don't feel like, I'm being watched or I'm lopsided, so I can't wait for my next competition. Dr. Angobaldo's bedside manners, for me and my experience, were wonderful. He was very positive throughout the entire process, starting from the consultation to the pre-surgical and post-surgical.
All of the doctors that operate right here out of Forest Park Medical Center, Dallas and Frisco, are featured on our website. You can see lots of videos and even request an appointment. Check it out. It's bestdocsnetwork.com. And now we're going to check in with our next best doctor. It's plastic surgeon, Dr. Matthew Trovato.
Cleft lip is basically the failure of the two halves of the nose and the palate and the lip to completely form and move into place. If it's the right half, then it becomes a right cleft lip or palate. If it's both halves, then it becomes a bilateral cleft lip or palate, or vice versa, a left. Most often in the US, cleft lip and palate is detected via a prenatal ultrasound.
So at about 21 weeks, at the anatomy ultrasound, they found that he had a bilateral cleft lip and probably palate as well. So at that point, we were, referred to another doctor for high-risk pregnancy and things like that, and told to seek out a surgeon for when Nolan was born.
In baby Nolan's case, this is his nasoalveolar molding device that we created with one nasal stent on either side to help improve the nose on either side of the cleft lip. And then there's an area back here where the palate and the nasal septum is sitting. Nolan wore this device for about 10 weeks prior to surgery, and each week we made small adjustments and manipulations to improve the shape and projection of his nose and improve the position of his nasal septum.
Dr. Trovato told us about the NAM device and how it would basically move that piece of Nolan's lip into place before surgery, so that when they did surgery, it would It would just be stitching everything together as opposed to having to move the piece of his lip into place. So it would be a lot easier for him in recovery and just yield a better outcome as far as scarring and surgery went. I would absolutely recommend using the NAME device, and it made such a huge difference in how he looks now. I mean, there are times it was super stressful, very emotional, but everything turned out wonderful. We couldn't have asked for a better doctor in Dr. Trovato.
Stephanie has a question for Dr. Pero. She'd like to know, can someone with severe allergies be helped with surgery?
A lot of patients have severe allergy problems, and many of them also have chronic sinus infection problems and/or nasal obstruction. Sometimes those patients can be helped with surgery, and typically like to make sure that we have their allergies under as good a control as possible before deciding to proceed with surgery. In other words, the allergies themselves might be contributing to swelling in the nose, which could be contributing to blockage of their breathing, could be blocking the openings of the sinuses that lead to sinus infections. Our hope would be that we could treat the allergies by themselves, which would decrease the swelling enough to improve their airway and decrease the severity and frequency of the infections. In some patients, based on their anatomy, that's not possible, and those patients are ones that would benefit from surgical intervention.
For more information on Forest Park Medical Center, Dallas, Frisco, to request an appointment, to receive more amazing videos of all of the doctors that operate right here, check out our website. It's bestdocsnetwork.com and click on the Forest Park Medical Center tab.
That is the place to go, and right now, Candace, the place to go is our next doctor who operates right here out of beautiful Forest Park Medical Center. It's orthopedic surgeon, Dr. Rick Burg.
Back pain just sort of snuck up on me after I had my son. It gradually got worse to the point that I needed somebody to help me out. And that led me to injections, therapy, things of that nature, and it just didn't work for me. Finally, somebody suggested that I see Dr. Burg, and so I made an appointment with him.
Well, the first thing we need to do when we see patients come in is get a proper diagnosis. We need to get the proper imaging studies. We need to understand the problems we're treating as spine professionals. And once you have that understanding, you come up with the proper diagnosis, you can come up with the proper treatment. So most people get a long regimen of conservative treatments, including all the therapies, medications, pain management treatments with injections, sometimes spinal cord stimulators. There are many different technologies out there that we have to try and actually have to consider. The last thing you want to do is make a patient worse because you picked the wrong treatment for them.
Dr. Burg looked at my x-ray. Right away he could see that I had a spondylolisthesis. The condition that I had wasn't going to get better. A spondylolisthesis needs to be fixed surgically. There's just, you can rehab that particular condition if you haven't declined to the point that I had already. So really therapy wasn't going to get me strong enough to deal with that. Eventually it led to needing, a pretty invasive surgery.
And what I saw in the x-rays was something we commonly treat that has a very good likelihood of significant improvement being treated. When you see spinal instability causing pinched nerves, leading to leg pain, numbness, tingling, and weakness, and then a lot of back pain that's mechanical in nature, that's something that can be fixed with surgery. After an extended recovery period, after some recovery, these patients do very well.
Honestly, I have healed so quickly. It's just over 6 months for me and I'm almost completely fused. So, I feel fantastic. It's like the pain I had is gone.
One of the things that is important in nursing or any type of career is making sure that everyone is well educated on what the expectation is of the facility. When I became the CNO here at Forest Park, I wanted to be able to focus on clinical education to make sure that we were always providing safe care to our patients and that all of our clinical staff were able to be educated on doing the same thing every single time to make sure that there was no room for any type of errors to occur. With that thought, we developed an educational program and hired a clinical educator that is master's degree prepared to be able to provide that type of education to our staff.
My role as clinical educator here at Forest Park is just to make sure all clinical staff are up to date on all evidence-based practices and current literature, and making sure that we provide our patients with top-notch care that is contingent on what research is backing these days. I teach anything from American Heart Association classes to ventilator classes, to classes on hemodynamics, to classes on basic needle sticks, blood draws, anything in the healthcare arena.
Clinical education is very important to both of my areas because as everybody knows, healthcare is always changing. We are updating our processes, we are finding new and better ways to take care of patients, and I want to ensure that my staff is doing everything they can to provide the best care they can to our patients. And so here at Forest Park, we have our clinical educator, Dan Cloud, who is very active with the staff, finding out what areas they feel like they need education on and finding out what is the newest research and articles that are out so that we can make sure that we're staying abreast of all of the newest research and practices.
Just seeing some of the nursing staff or clinical staff, when you're teaching them something, when it finally clicks or they can take it back to the bedside with them in their interaction with the patients, that is the most rewarding for my job. I can talk and tell somebody how to do stuff all day long, but if it doesn't get taken back to the bedside, then it's not doing any good, especially in a healthcare setting.
Did you know that Forest Park Medical Center is equipped with a high-tech tube system that sends stat lab work from any location in the hospital to the lab? This enables the lab to test samples quickly for better patient care.
The Da Vinci robot has been used extensively in gynecology since about 2008, and it allows us to do major surgery on patients that used to would facilitate a large incision, but now we're able to do these through smaller, minimally invasive incisions, allowing the patient quicker recovery and quicker return to our normal activities.
I work a full-time job. I perform on the weekends. I'm a jazz blues singer. The recovery time seemed to me to be a little bit more because of the weight issue. But the robotic procedure kind of lessens that fear.
Wanda was having a lot of pressure down below, and she stated that she felt like things were changing inside of her. She knew she had the fibroids, but she felt like they might be growing again. We did a sonogram. It showed that her uterus and fibroids collectively were about the size of a volleyball, and definitely could be causing the pressure and the abdominal pain that she was experiencing. It's kind of like a muscle cramp in the uterus. And unlike muscle cramps in our other muscles, these muscle cramps don't go away, they stay.
He explained the process to me, and I said, this is the person who's going to do the surgery. And there's another procedure, but the procedure was done. And within less than 2 weeks, I did a performance. I was very pleased with the outcome.
Well, we did her surgery in mid-afternoon or so, and I saw her that night. She says, I really could go home right now, but I think I'll just stay. So we kept her overnight. The next morning she felt great. She was ready to get out of there. I saw her back about 2 weeks later, and she had already done her first performance. I think she said it was 10 days from the time she had her surgery to the time she was back on stage.
I know my doctor said, don't do anything, don't drive for at least 3 or 4 days, but I felt good, you know. So, you know, I would recommend this to anyone who is thinking about having this procedure.
For more information about Forest Park Medical Center, check in on all the great videos about Forest Park Medical Center, your destination to better health. Even request an appointment from one of their outstanding doctors. Head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. Right now it's time to head to our next doctor right here out of Forest Park Medical Center. It is Dr. Jorge Casas.
Bone tumors come in all varieties, both malignant and benign. The benign bone tumors are much more common than the malignant tumors. Malignant bone tumors we tend to see in a younger population, typically teenagers, in both boys and girls. Benign bone tumors stretch across all age groups, from newborns to very old people and everything in between. Each tumor is unique and has a particular behavior. The majority of these tumors are benign, and so if the area that is involved is relatively small, the patient is not having any symptoms, and the risk of that breaking spontaneously is very low. Most of the time, these patients are simply observed, and we will get routine x-rays in the office and make sure that it's not getting any bigger. A lot of bone tumors cause no symptoms at all. If bone tumors do become symptomatic, typically patients will present either with an unexplained pain, and typically it will present as a dull, aching pain. Initially, people may only notice it at nighttime, at bedtime. When someone presents with a bone tumor, the first thing that you have to do is you need to stage the tumor, which means that you need to find out the true extent of the tumor, whether if it's confined only to bone or whether it extends to the soft tissues. And that's determined by multiple types of imaging. That includes plain x-ray, a CT scan to better look at the architecture of the bone. You use an MRI to delineate the soft tissue extent of the tumor and how far it extends in the bone marrow. And then a bone scan is an imaging modality that we typically use to look at the whole skeleton to make sure that this isn't some kind of process that's involving multiple different bones. And in the majority of cases, with those 4 imaging studies alone, you typically will have enough information to make a diagnosis. And in many cases of bone tumors, if they're benign, most of the time you don't even need a biopsy, and these patients can just be monitored with routine office visits, physical exams, and x-rays.
Patty has a question for Dr. Richard Ha. Can I take fat from one area of my body and put it in my breast?
The answer is that the jury's still out. There's a lot of science that surrounds this, and what we do know is that it may not be completely safe. There is some data that suggests that injecting fat into the breast may increase the risk of cancer development. So for right now, until we have more information, it is not recommended that we inject or harvest fat from one area of the body to inject for the purposes of breast augmentation. So consult your plastic surgeon to have that discussion. It is probably still safer to undergo breast augmentation with conventional breast implants.
Did you know Forest Park Medical Center Dallas campus was the first hospital in Dallas to use the Makoplasty robotic arm for hip replacement and partial knee resurfacing?
Just noticing things changing as I got over 50 years old. You know, being a little more tired, and that just wasn't me. I started just seeing TV commercials with low T and was kind of like, well, what's low T? And then they start talking about the symptoms. So, you know, I went to see Dr. Friedman, and we did a blood test just to run the test, and my testosterone level was definitely low.
Low testosterone is a condition in which men produce less testosterone than adequate to maintain their vitality. In that respect, it's energy, libido. Low testosterone can cause depression. It can cause trouble sleeping. It can cause high cholesterol. It's generally a slowdown of the body if a man has a low testosterone.
He said, well, we'll prescribe the androgel, try this and you should see a difference within probably 2 to 3 weeks. But within 2 weeks, I could see a difference.
When Mr. Townsend came in, he was complaining of many of these same factors: decreased energy, lack of excitement with normal things that made him happy previously, and he asked me to check his testosterone during a physical. When we checked it, we found out that it was low and he was deficient in testosterone. So we decided at that point that he couldn't improve it all that much, so we would go ahead and put him on treatment. He went on treatment and felt great.
My energy level, my exercise routine, my mental state just seemed like it was a little better, and you know, just like not where I would have those kind of, at the end of the day, just feel tired and feel kind of like just not wanting to do anything and just kind of sit for a little bit or something. Now I felt like, you know, I just had more energy. You know, I maybe felt like I was back in late 30s or 40 years old instead of being 53 years old.
Within a month later, his testosterone unfortunately was too high, but he felt wonderful and he felt great, but he decided that he didn't want to go on the medication at that point. He wanted to try the diet, the exercise, and try and modify his lifestyle in order to boost his testosterone. He did those things, and he did great.
Dr. Friedman, I think, is great. He's always seems like he's very caring and listening to what, you know, issues would be, and if there was anything else going on, he'd ask me about background. Him and his staff are all very professional.
Gastroesophageal reflux disease is actually commonly thought of as heartburn. The main malfunction is a malfunction of the valve at the lower esophagus, because food should be able to go into the stomach, but bile, acid, and food should not reflux back into the esophagus. And often patients have symptoms from this. One of the typical symptoms is burning pain in the chest that represents the acid refluxing back into the esophagus. Some people have difficulty swallowing where they feel like food is getting stuck in their chest. Some people can have abdominal pain, and a lot of times patients have trouble at night. They can't sleep flat in the bed because the acid goes up into their throat. Gastroesophageal reflux disease can be treated in a variety of ways. Usually mild GERD can be treated with lifestyle change, avoiding certain foods, propping yourself up on pillows at night in bed, losing weight. Then when patients really are not relieved of their symptoms with that, they can move on to medications. But about 40% of those patients who take medications are not well controlled with medications. And therefore, we have a new treatment called the LINX Reflux Management System that I'm performing here at Forest Park Medical Center that will treat this disease. And it actually will treat the disease at the source of the disease, which is the weakened lower esophageal sphincter. The LINX procedure is a new FDA-approved procedure, and I am partnering with Forest Park Medical Center to be the only center to perform this procedure in Dallas. It's a very simple and elegant treatment. And basically, the LINX procedure involves a band of titanium beads that have a magnetic core. And this is basically a necklace of magnets that are placed around the lower esophagus to help augment the weakened lower valve. And what happens with this necklace is that it actually will open when you eat, and it breaks those magnetic bonds, but then it closes and doesn't allow acid or fluid to reflux back into the esophagus. I'm really excited about the LINX procedure because I think it's a revolution in the treatment of GERD. I think patients who've been suffering from reflux symptoms and decreasing their quality of life, and it's affecting their normal activities, this is going to be a great solution for those patients.
Thanks for tuning in to another edition of the Best Docs Network featuring Forest Park Medical Center, Dallas and Frisco. Forest Park Medical Center is your destination to better health.
And don't forget, for more information about Forest Park Medical Center, as well as request an appointment with one of their outstanding doctors, head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.